Welcome everyone. My name is Masis Isikbay, and I'm one of the radiology residents at UCSF. And it's my pleasure to have the opportunity to talk to all of you today about a topic that's very near and dear to my heart. This is part of a webinar series put on by the Society of Interventional Radiology and the Resident Fellow Student Section, the RFS, and it's part of our COVID webinar series. And I'm going to be discussing some virtual and online interventional radiology resources that are helpful for students and junior trainees to use, especially during the shelter in place and curfew times that we are in now, but also that I think will be helpful beyond these times when things go back a little bit more to normal. So I just want to mention that I'm very excited to have this opportunity to talk to all of you today. I really appreciate everyone taking time out of their day to log in. And while the content here is definitely very useful for medical students and junior trainees, I do want to say that I think that it's also useful for more senior trainees and fellows and even attendings to be aware of this content because they are in a position to share it with other people that may benefit from it. So I hope we have a variety of people here, and I also hope that this webinar reaches people of all different levels of training, because I think it is quite useful to be aware of what kind of materials you can pass along to other people, even if you don't need them for yourself. So we'll get started here as people log in, and yeah. So thank you so much, everyone, for joining. And I think we have enough people logged on, so we'll go ahead and get started. I just want to say again, thank you everyone for logging in and joining. My name is Masis Isikbay. I am a radiology resident at the University of California in San Francisco at UCSF. And it's my pleasure to be able to talk to all of you today about a topic that's very near and dear to my heart. This is about virtual interventional radiology resources for students and junior trainees that they can use during the shelter-in-place times that we find ourselves in, as well as the curfew times where there's limited access to rotations, but also resources that will be useful beyond. And these topics are definitely most helpful for people who are a little bit more junior and are just getting exposed to interventional radiology, but I think people of all backgrounds, more senior residents and fellows and attendings, may also benefit from being aware of these resources because they can pass them along to the people that they're training. So this is something that's put on with the Society of Interventional Radiology, specifically the residents, fellows, and student section, the RFS, and it's our part of the COVID webinar series. So thank you so much, everyone, for joining, and we'll go ahead and get started. So just to start, I just want to mention that I don't have any disclosures, and I think that this is a pretty important topic, and it's actually quite funny because just this morning, one of my co-residents, Dr. Ethan Spear, actually gave a talk about disclosures and his research that dealt with disclosures, and he did point out that oftentimes there is a discrepancy both in our specialty and across medical specialties with how we disclose things, and also how we maybe make a joke of the disclosure slide, which is something that I myself am doing right here because I don't have any disclosures and no one's compensating me financially. But I do think he touched on something very important, and it is very important to be very transparent. And for myself personally, I just want to explain that I am going to be showing some websites today, doing some live demonstrations, and one of them is my own website. So I just really want to be very clear that my own website is not for profit. I run it out of my own budget, and I don't take any, I don't have any advertisements. I don't have any sponsorship. I don't require anyone to pay for a subscription. I have a YouTube channel, but I refuse to put ads on my YouTube videos because I myself hate when educational videos have ads. I think it just detracts from the material. I do work with some companies to basically, some companies donate equipment to me to use for educational reasons, so like old or demo products or expired equipment they may pass off to me, but there's no financial incentive. I don't advertise for any companies. So I just want to be very clear that all of my motivations are around education. So those are my disclosures. I don't have any. I will say, though, that while I don't have any traditional disclosures, there is one thing I want to explain, and it has to do with how passionate I am about this topic. This is something that is very, very important to me, and is something that I invest in quite heavily. Specifically, I put a lot of my own personal time into this particular topic, creating educational resources for radiology, interventional radiology. And just to demonstrate that point, I want to show what I used to look like when I was a medical student, before I really got involved in all of this. So as you can see, back then I was actually pretty well adjusted, and I spent my time kind of in a balanced way. I had hair, there was no white in my beard, and overall, things were okay. But now I look more like this. So I think people can notice there's been some changes. If I was to dictate this as a report, I would say there's been interval worsening in appearance compared to priors, marked interval worsening in appearance. And this is this is me as a surgery intern last year. Actually, towards the end of the intern year, I'm post-call. Instead of sleeping, what I decided to do is just keep the party going, and I gowned up and in my apartment started recording some procedural videos because I was very excited. And I think that it just maybe demonstrates how maybe slightly obsessed or engrossed I am in the topic matter. It's really something that anytime I have free time, this is what I like to be doing. So I just wanted to kind of demonstrate, the magnitude of kind of how invested I am in this. So if I have pressured speech, or you notice I'm getting too excited even during this webinar, you'll be able to appreciate why that is. So I think what's tough about these webinars too is that it's very hard for me to tell if my jokes are landing. But I'm just going to assume that everyone who's logged in is laughing and just keep moving forward. So even, in light of the fact that the years have been tough on my appearance, not only is that true, I think the times have been tough on everyone and kind of everything. And I think this Bob Dylan quote is pretty timely right now. The times really, they are changing, and this goes for pretty much everything. And I just also want to take this moment to say that amidst everything that's happening with COVID-19, that's happening with these social changes and these issues, I just want to express that I hope that everyone is doing okay. I hope everyone's safe and healthy, and doing all right amongst these times, because I think that these are challenging times. We're starting to realize a lot of things that maybe weren't so obvious before, and it's giving us a lot of food for thought about how to move forward. And the topic of this talk is a very small piece of the puzzle. However, I do think that the topic of education, specifically medical education, amongst all specialties, but in this case in radiology, interventional radiology, does also touch on some of the things that are happening. So I think that it's important to realize that we work very hard in medicine to give the best care, but it's also to give the best care to everyone, regardless of background, regardless of socioeconomic status. That's why we do what we do, and I think education goes the same as well too. We should strive to get to a point where, regardless of where someone is training, they will have access to the best training so they can be the best clinicians, so they can give the best care for other people. It shouldn't matter what their background is, what their beliefs are necessarily. It really, so I think as we move forward with this talk, I want you to keep in mind this is all very much in line, I think, with being inclusive and reaching as many people as we can, both as trainees, but also as educators and clinicians. And when we think about how the times are changing, maybe specifically for the topic of education, I do want to talk a little bit about how a video-based curriculum across different topics has become so popular, especially now during these COVID shelter-in-place and curfew times. So just running through a few examples, makeup tutorials. This is something that I think has been very, very established for quite some time, where there are these pretty amazing YouTube makeup tutorials. Clearly, you can see from the pictures before, I haven't benefited from any of them, but I think people are able to do quite a bit. And similarly, I think learning musical instruments, people have been learning how to play guitar and violin, piano from the internet through videos now, and it's pretty remarkable. Apparently, even animals are learning how to play musical instruments, which is pretty remarkable. It's quite the time. More specifically to the COVID-19 situation, with the closing of all the barbershops and the salons, there's this huge demand for learning how to be your own barber or be your own colleagues or partners barber, where people or roommates, people that you live with. So anyway, people are learning how to cut hair like they're showing here, and that's been pretty remarkable. In the backdrop of all this, I think it's important to realize that certain medical specialties have actually been benefiting from online video curriculum this entire time, maybe definitely before even COVID. I think one example is general surgery, where there are these pretty sophisticated video libraries now of procedures and all these YouTube videos. And just so I don't bury the lead too much with regards to my presentation, I'm advocating for more of those for radiology, really all of procedural radiology. So this is just one example. Just mute myself. One of me is already too much. But anyway, so here what I'm doing is I'm showing how to use a UE needle with a syringe on the back of it to aspirate ascites. And this is me recording in my kitchen. I've gowned up and gloved up. I've borrowed an ultrasound machine from one of my other co-residents, Dr. James Frencher, who's very generous in letting me use his equipment. And I made this model out of gelatin, and I put a Ziploc with yellow food coloring in fluid. So that's the ascites that you see that I'm aspirating there. And this is me just going through all the steps of just this aspiration and how to kind of advance the UE needle. And the reason I use this as an example, it's not a terribly complicated procedure. However, one of the first IR procedures I did as a medical student was a paracentesis, and I did not really understand the steps and how the UE needle worked. And I remember, still to this day, the patient that I was working with could sense my uncertainty and discomfort, and it made the patient uncomfortable. So I think for many reasons, it can be very, very helpful to have these types of materials for all types of trainees, so they learn how to do steps, important key steps, before they step in the procedure room, before they kind of advance a needle into the patient. And later on I'll show you more examples of how this works and what this entails, but I think this is so central. And I will say that it has taken a little bit of time for this ideology to catch on, but especially now with COVID-19 and shelter in place and people not being able to get as much rotation time, this idea has really taken off, and people have realized that it's unambiguous that materials like this are very helpful. So just to give a little bit of an outline of what we're going to be discussing during this webinar, number one, I want to give a little bit of background, even a little bit about my personal story about how we kind of got to this point, because I think there's a lot of good parallels that I can draw between what I've experienced as a trainee and what other trainees are experiencing. Then I want to also discuss what types of resources are currently available now. What can you use immediately for the purposes of education for yourself and others? What can you log in to tonight or tomorrow or the next day? I'll do a live demonstration to show kind of the websites and the resources that are available. Next, I want to talk a little bit about what's on the horizon. What are some of the next steps that we're working towards? And tying in with that is kind of the last topic. What can you do to get involved? it doesn't necessarily have to be, and I'll explain, it can be simple things, but there are ways to get involved if you're interested that we'll talk about as well too at the end. So before we get too far along, I want to talk about a central theme from my webinar, from this presentation. And really, if there's only one thing that you take away from this, I would like it to be this particular theme. During these uncertain times, when there's so many things that are changing, it can be difficult for us to understand what we should be investing in. This goes for all topics. Maybe very clearly can be the literal economic investment. I myself, when I look at my retirement accounts, after I finish crying, I try to think about, what should I be investing in, which markets, what should I be doing? And similarly, I think when it comes to our specialty, when it comes to radiology, interventional radiology, amidst all the changes that are happening and all the changes that are on the horizon across different spheres, it can be a little unclear at times what we should be doing to secure our future, to secure the success of future generations of radiologists, interventional radiologists. And I think that what I want to impress upon all of you today is that while there is a lot of uncertainty, in my mind, there is the low-hanging fruit that's very obvious to me, and I think others will agree, is probably what we should always be investing in without fail, and that is our trainees, starting with first-year medical students. And I think if we think about this, we'll realize that if we're thinking about the future of our field, where it's going to be in 10, 15 years, it is literally going to be the first-year medical students who get involved in our specialties that are going to be defining where the field is going to be going in 10, 15 years. They're the ones that are going to be defining, how the field is represented, because they'll be the ones who represent it. So in my mind, and what I want to impress upon all of you, is that if you focus on being good educators and attracting, wholesome trainees who not only are talented but are kind-hearted, have a desire to be good clinicians, and you support them and you make it easy for them to be successful, there's no way that we can't be successful with that model for our specialty, because their success will define the specialty's success. So a lot of what I'm going to be discussing, and even my own personal story, deals around kind of being supported as a trainee, especially early on. So for myself personally, all of my interest in this, in both radiology and education, began in medical school. And I have to admit that this is me at the start of medical school in my first month. This is how I felt. I was really struggling. It was all this information that was being thrown at me, and I wasn't really absorbing it. And I didn't come from a background of medicine. My health literacy coming into medical school was actually not great. And I really didn't know where I was headed and what I was going to be doing. So I was struggling in the beginning. That being said, I feel like I was very fortunate because I came upon a interventional radiology symposium that the Mass General Hospital, MGH, had put on early on in my medical school career. And this was such a game changer for me. So, it was put on by the program director, Dr. Greg Walker, who was just so passionate about his field and so excited to bring in more medical students and teach them about all the great things that interventional radiologists could do and where the field was going, how the training program was being improved. And, he set up all of these different stations, like one of the ones is shown here, where we were ablating beef livers, seeing, the ablation zone. At other stations, we were doing ultrasound-guided biopsies. It was so hands-on, so much fun. And during that time, I met a resident there who later went on to be an interventional radiology fellow there, whose name was Hosam Ataya. And he became such a great role model for me, where he really brought me into the fold. Early on, I got his contact information and started talking to him, and we met up, and he got me introduced to Dr. Greg Walker and helped me get involved in doing a rotation there later on. and he really just, he was also so passionate and excited, so willing to help, and it made quite the impression on me. So this was in my preclinical years, and to contrast that with kind of how things went during my third year, this was essentially my experience during my third year as a medical student. And, I really was struggling. I was falling off the bike, and my attending, as you can see there, was pulling their hair out, kind of being frustrated with me because it just wasn't going as well as I would have liked. And actually, I use this analogy literally because I had an attending during my third year who would routinely compare me to a child, specifically a child who didn't know how to ride a bicycle. And, just like the positive experience of the MGH Symposium stuck with me, kind of this negative interaction also clearly has made its mark on me as well, where I really didn't feel sure of myself. I didn't really feel the same level of support, and it turned me away from other specialties because I didn't feel welcome there. Contrastingly, though, I was again fortunate to come across more wonderful radiology experiences, and the radiology suite and interventional radiology suite became my happy place during my third year. I would literally go there whenever I could because I met a particular clinician there, Dr. Jonathan Opersuth, who was who had come and built up the practice at this community hospital, and he showed me all the value that someone who was well trained in diagnostic and interventional radiology could bring to a care setting. And he literally transformed the care at our community hospital because there was no one else there before who did endovascular work. And he came and brought, uterine artery embolization, PE intervention, things like kyphoplasty. Actually, one of the first things that cases that I ever saw with Dr. Opersuth was a kyphoplasty that actually went very well. And I was blown away because this one individual had come to this care network and was now providing all of these procedures that the patient population was totally naive to. And I remember just, looking at Dr. Opersuth and thinking, like, this is who I want to be. This is the type of clinician I want to be in the future. Not only because he's such a great clinician and he's doing so much for patients, but also because he was a wonderful educator and mentor to me and got me excited about the field. And I learned the most from him, which is why I consistently would go back to learn more. And I'll kind of fast forward through everything else here, bringing me up to where I am now. But I've been very fortunate that since those positive experiences in medical school, the rest of my experiences with radiology have been fantastic. And I use this picture here because I felt so supported and guided throughout my path by all the other radiology rotations that I've had, where it became so obvious that obviously I was going to apply into radiology. So I ended up doing an interventional radiology sub-I at the Mass General Hospital with Dr. Walker, and then I went on to do a second one with Dr. Jeffrey Weinstein, who's the program director at Beth Israel at the time. And he was also such a wonderful mentor to me and such a wonderful role model, where he was so patient and understanding, but he also taught me a lot about the specialty, both deliberately, but then both in the way that he carried himself. I met another fellow there, Dr. Matthew Del Guzzo, who was also so wonderful to work with, and he's still someone that I keep in touch with today, who was just also so fantastic to work with, and they just further, led to the positive experiences that I had in radiology and interventional radiology. Now I'm in the diagnostic program at UCSF, and I just am so grateful to be in this program because I feel continually supported. My current program director, Dr. Sunmi Cha, she is one of the most amazing mentors I think I've ever met in my entire life, and she is literally this person in the picture who's holding my handlebars and kind of guiding me towards success. So I think she's on the call as well too, and I'm just so grateful to know her and to have her as part of my training. experience. To have someone like that involved, it's tremendous. So in the backdrop of all of that, getting more exposed to radiology and falling more in love with radiology, I also started getting more involved in education, because I started to realize that I was very, very lucky to have all of these wonderful role models and mentors, but I wanted to be a version of that for someone else. So I didn't want to wait until I was an attending. I wanted to start thinking about that now. And it started with STEP and word prep. So I made a website that was literally called StepWords. This is what it's called today as well too, where my initial focus was to think about all of the material that we were tested on, both on standardized exams like board exams, shelf exams, but also the things that we were routinely kind of quizzed and grilled on the words, and try to combine them in an elegant way where people could kind of come to one place and everything that they covered would be relevant for all the different things that they were trying to do at one point. But then later on, as I got more exposed to clinical medicine, my interest became a little bit more clinical focused, where I actually bought a little camera that I could put on my glasses, and I could record myself doing little procedures. So it started with like suturing techniques, and I realized that I could record kind of from my perspective what I was doing, and I felt that point of view was very, very helpful, because that's literally what you're looking at when you're trying to do something. So I think this is when my friends realized that I was kind of maybe a lost cause when they were trying to get me to hang out, and I instead was showing them pictures of myself, because I basically, here what I've done is, I have the little camera that goes on my glasses, and I hook it up to a battery pack that with the wire going through my scrubs. I was like, isn't this great? I can spend hours and hours recording. And they were like, oh, okay, that sounds good. Maybe we can, go to a restaurant or something, but that sounds great. You can stay in and just, record videos of you suturing. But I will maintain that I think it's been pretty cool. And now what I have done as I've gotten more sophisticated is, this is actually my current kitchen. I have, the drapes, and I scrub up. I can get an ultrasound machine, all the equipment, and I can record things, I think, that look, if I make phantoms and models, I can record things that are very representative of what's actually happening in the procedure room, which I think, and I'll show you some of the videos, but I think that they are quite useful. So, as I got more involved in interventional radiology, this became more and more a passion project of mine. And it didn't stop there. So now when I'm in my diagnostic training, another thing that I realized is that, and actually it's something that I realized as a medical student as well too, when I rotated on a diagnostic rotation at Mount Auburn with Dr. Pierre Sisson, who's the program director there. I realized that there is so much on the diagnostic end that is important and really critical for radiology, that you can record
a sense of kind of where they are.
And here we'll mute myself again. This is you can record to give people kind of the highlights. And basically what I realize is you can record anything that you look at, and if it's on the computer, it's actually even easier because you can just do screen recording. So this is me actually going through a case where a patient has a very high PE burden, and this case went to catheter-directed thrombolysis. And I realized that, we have all this great imaging now. You can de-identify anything, and you can show people all the things that you would point out on a PAC station. And you can make these wonderful narrated videos where you go through all of the imaging. And, this is, I think, very, very helpful. And it doesn't just have to be imaging. I also realized you could do the same thing for PowerScribe or Epic or any EMR. Anything that you do that's technical on the computer, you can record so other people know exactly what you're doing, where you're looking, what you're clicking on, and it can be a very, very useful tool. So on that note, I think I just want to quickly summarize, and we're just going to focus more on the pieces of the website that are helpful for radiology. But what I've tried to do is actually create good resources for trainees of every level, so that people who come after me, I can give them content that is actually going to make it easier for them to be more efficient and essentially make better use of their time than I did when I was at their level. I remember, in medical school, my class was was the last year of what was called the old curriculum. And I remember there was a lot of angst because the class after us was getting all of this new teaching and new structure, and the medical school was not being very subtle about how they were testing performances between us. So I guess understandably, a lot of people in my class were very anxious and kind of insecure about, they're getting better teaching and then they're going to show that they're doing a better job. Why, we're not getting the better teaching. I can understand that, but I think it's important to shift our mentality and realize that if people that are coming after us are not doing better than we are doing, I'm not really sure if we're working towards progress. So I think it should be a given that people that come after us should ideally have better resources than we did and should be able to accomplish more without having to constantly reinvent the wheel. Otherwise, we're not really moving forward. We're just kind of standing still. So the point is that, and please reach out to me, anyone, if you're interested in some of these other these resources that I have. They're all available online. But there's a question archive for medical students, for STEP and SHELF. There's all these clinical guides that I have that are helpful for the wards. I'm very involved in the general surgery intern onboarding here, and I've made all of these EMR tutorials, really the things that made me an efficient intern and saved me the most amount of time so I could spend more time with my patients. So there's a whole intern year guide that I have. As far as the diagnostic training goes, there are these search patterns that I think are pretty useful, that are also there as well too. And we'll go through some of them in this talk. But then there's also this procedural primer that we'll talk about that really covers all the things that I wish I knew when I started IR. So there's something for everyone. So now what we'll do is we're just going to go through some of the resources that you can currently use now. This is what's available. It's online. It's free to use. So we'll start with the SIR website. So if you go to rfs.sirweb.org, this is the Society of Interventional Radiology's website, the resident, fellow, and student section. And there are a lot of great things here. I want to focus on one particular set of resources that has recently been created. So I want to highlight them for everyone. It's for the medical students. So you will just go to the medical students site and go to the IR Clerkship Guide. That will bring you to here, the IR Rotation Survival Guide tab. Now, I want to be clear, this is under the medical student section. However, the content here is probably going to be very high yield for anyone, regardless of their level, who is getting exposed to a particular clinical rotation for the first time. So, especially at a particular site. So, I think that it's important to realize that, definitely if you're a medical student, but even if you're a resident, this can be very, very helpful. So these rotation guides, were created to kind of cover material that's universal, but then also material that's specific to a particular site. So you can click on the site-specific section down here, and maybe before we go too much further, I think it's important to appreciate this disclaimer. Program directors across the country have kind of come together to agree that it's not really a good time right now with COVID-19 to be doing away rotations. So while these site-specific guides are very helpful for anyone who is doing an away rotation or would have been doing an away rotation, I think that it's important to realize that even if you're not doing away rotations, you can come here and find your institution, and it will still be just as helpful to you to figure out the logistics of your home institution's IR rotation. So this is something that people are going to be adding to more and more as time goes on. So it's by no means complete, but there are already so many great guides here. Like we'll go to the one for Kaiser LA just to show you what's in the guide. And I think that these are really, really remarkable because they cover all the things that you would want to know to hit the ground running at a rotation, starting with the logistics of kind of like how to, again, right now we're not so focused on away rotations, but when the time comes, it will kind of explain how all of that works, kind of the logistics of getting there, stipends, scholarships. It's not too verbose, it's very to the point, but this is all very high yield information. How you're going to handle consults at each place, which will vary, how clinic works, which again will vary, presentations, all those things. So I think that these guides are very, very helpful. So I would highly recommend that everyone check them out. Now, that covers a lot of the material that's specific to each site. I think it's also important to realize that there is some information that's very universal, so regardless of where you are is going to be helpful. That's under the rotation resources. So that will bring you here. And this is a little bit more where I kind of came into play with the project here, where I ended up creating this primer for new trainees in IR that's linked here. And I think that for every medical student and really for every junior resident who's rotating on IR, I think it's really important to check out this primer because, we'll go through the different sections, but there's a ton of material here that kind of breaks down everything in a very simple way and kind of shows how to do things that I think you'll find really helpful. So here we have kind of certain sections that are highlighted that are helpful. And then there's, we'll talk more later, but there's also kind of these elements of like the fundamental peri-procedural tasks that are the building blocks of every radiology procedure that are also highlighted here. There's some information about reading scans. We'll go over that in more detail in a second. But those are all kind of from my interventional radiology primer for new trainees. Also, though, there are other resources that are going to be curated and are constantly being curated here. These are, these RFS procedure guides that are here, these FIRE videos on YouTube, which are great, particular books that are very popular, and then other things as well, too. So this is a wonderful place to start if you're new to radiology. Again, it's under the med student section, but I think for new trainees, especially if you're going to a rotation for the first time at a particular site, come here and see if there is anything that can be helpful for you. To transition a little bit, I'm just going to go to my website here. So this is stepwords.com, very easy to get to. And I just want to show you a little bit about what I have here. And I just want to show you, if you just go to the homepage, www.stepwords.com, the primer for new trainees in IR is featured here. So you can just come here and very easily get to the primer for new trainees in IR. And I think this is the one page that I would definitely recommend bookmarking, that I think that everything kind of that I have links through here. So if you know where this page is, you can get to everything else. And on that topic, I just want to quickly show you some features of the website. Number one, at the top, I always use this breadcrumb list so you can see other like master pages. So if the primer is under the interventional radiology section, which is its master page, so you can always go back. So I think that's very, very helpful and you can go all the way back to the home page that way. And then we can go back to the primer for new trainees in IR. So it just shows you how you got to where you are. So if you find yourself somewhere where you like the content and you want to see other similar things, just look to the breadcrumb list up there. It's all clickable. Furthermore, I always have a table of contents with different headers. And if you want to get to a particular topic, like the startup trays, you just click and you get to the startup trays here. So that makes it very easy to navigate. And then there's always a back to the top arrow that brings you back to the table of contents. So this, if you have a long guide like this one, makes it very easy to go back and forth and kind of navigate to different sections. Now that we have some of those logistics out of the way, we're just going to quickly discuss there's a ton of content here. We're just going to highlight some of the most pertinent things that I want to show you. If you go through, everything is organized in a pretty linear fashion, and everything links out to different pages and different guides and things like that. Starts with the fundamentals, which we'll go over in a second, cover some about how to read imaging studies, which you have to do before you do any case. Basics, conversions and measurements, how to use ultrasound, suturing, startup kits and trays, how to scrub into cases, how to sterilely prep things, how to back table, filling syringes, flushing wires, going over all the equipment. This is a big one. We'll go over this in more detail with one example. Kind of key skills, how to get access, IJ access, big one. And then there's just kind of the skills during the case with like how to load things onto wires and take them off safely, how to close, at the end of a case, like, closing access sites, dressing things, suturing tubes in place, securing them. And then we get a little bit more sophisticated, combining techniques together about how to remove drains, how to remove chest tubes. And then we apply everything to procedures like a paracentesis and bring it all together. So just to go through these different sections, let's start with the fundamentals. This is what I call the fundamental peri-procedural tasks. These are the universal building blocks of any radiology procedure. And I start with these things because I think that it's very important to focus on the things that are universal, because they'll apply to everything. So no matter what case you do, you'll have to think about things like indications, contraindications, how to field the consult, what kind of sedation do you want to use, all the way to how you're going to dictate the report, how you're going to follow up. So those are all things that I try to kind of touch on in a universal fashion here. And for example, no matter which case you do, you're going to do some type of note. You're going to have to do some kind of chart review in H&P. So I have a whole section here about the kind of how you would do that in a generic sense for most any radiology procedure, and it goes through everything. I even have a template that you can import into Epic to save you time, with kind of a standardized format and smart phrases, so I think that's very helpful. Honestly, as a medical student, I really wish this is how I thought about all of my notes. I have to admit, sometimes I think as medical students, even as trainees, we can just kind of get into a mode where we're just trying to, get the paperwork done and move on. But, being intentional and knowing all the things that you're looking for when you're reviewing the chart, and very naturally putting that all into the note at one point, I think actually makes things very efficient. And then, being intentional when you're looking at vitals, what are you looking for and how is it going to change what you're going to do? When do you, for the physical exam, have to worry about looking at pulses and which labs should you look at and why? All of this is covered here. And I think maybe the best part is this end part here, discussing the assessment and summary, summarizing all the safety concerns. I think these go hand in hand together, and it's important to be very systematic and algorithmic so you don't miss anything, because these are the things that really do matter and can either protect or compromise the patient's safety. And I think what's also important is if you get this down as kind of second nature, as you're doing your chart reviews, you can make the plan so there are no surprises. When the patient comes down, you know what labs you need to send. You know what the sedation plan is. You know that you have to consent for it. You know if you're going to give antibiotics or not, or how long the anticoagulation is going to be held. You know what's going to happen, and then you can sign that out to the team when you're done. So I think that is really, really helpful. So those are the fundamentals. That's just one example. Another really basic element to interventional radiology is the diagnostic radiology component. And I think that these resources that I have here that I'm showing are very helpful for people who are diagnostic residents, but also for people doing radiology procedures. I really wish before my first IR procedure, I knew how to read a CT abdomen and pelvis, because I think it's incredibly helpful when you're doing your chart review to look at the imaging and know what you're looking at. So this is a video series that I created really initially for the diagnostic residents, but I think is also very helpful for anyone who's procedural, who's going to be working in the abdomen, where I just go through a search pattern. And it's all, I'll show you one example, but it's all narrated. I'm just literally going through all in this section all the different solid organs, and I kind of am pointing out all the key anatomy and explaining, using different orientations, what you're looking for, what it looks like, the significance, and I think that it's incredibly helpful. And this can be applied, I believe, to a lot of different circumstances. This is just one particular scan, but I have other CT scans and other imaging studies where I do something similar, which I think is really, really helpful. So that's another piece of the puzzle here, looking at the diagnostic imaging, which is featured on the primer. Taking things a step further, I think that interventional radiology equipment can get a little confusing, and I have to admit, as a medical student, I was really confused by all the different kits, even for things like chest ports and HD like this, like a tunnel dialysis line catheter, what the difference was and how to use them. This is actually, this topic, the equipment topic, was what really motivated me to get to record more videos, because I felt like this was really low-hanging fruit with regards to, you could record everything that was in the box and make an unboxing video. And here is where I want to discuss, there are companies that will give me equipment so I can make these videos. Like this is HD catheter, a dialysis catheter from Angiodynamics that Angie Quinter from Angiodynamics actually gave me to use. But I include the product information not because I'm trying to promote the company, but more because every piece of equipment is different. Even though it's this, they can all be the same type of line. If different companies make them or they're different models, it changes how you use them during the case, how the equipment works. And it's very, very important for people to know what you're using and how it works. It all works hand in hand. So I think it's very important for our education to also include specific products, because everything can change depending on who the manufacturer is. So here's an example. This is what I mean by an unboxing video. This is just me going through the HD catheter kit exactly as it comes, and literally going through all of the equipment and covering how it works, how to use it, how to flush everything, how to assemble everything. And I think that this can save trainees so much time, because the first time that you get exposed to something shouldn't be when you're gowned up and the patient's waiting on the table, as far as I'm concerned. I don't think there's really, in today's day and age, any reason for that to be the case. I don't think there's any replacement for in-person teaching, but I think that you should try to strive to expose patients or expose trainees to as much training as you can before, and you can show them all of these techniques and things like that, like how to flush, things like I'm showing here now, to avoid any wasted time during the procedure. So this is just one example of the unboxing, but then what I also want to show you, and what's particularly helpful, is that you can go over in more detail equipment that's very specific or unique to a particular kit. For example, for this particular HD line, there is a double valved peel away sheath. That's the one we have here. The company uses two valves because they want to cut down on the risk of air embolus. But because there are two valves, this peel away sheath cannot be operated, or if you're trying to crack it and peel it away, that has to be done differently. So in this video, I just go through how to actually peel away the sheath and how to crack it, because if you don't know that, the first time you're going to fumble with this is when it's going to be deep in someone's internal jugular vein, in their neck. And again, I think we can avoid that, and I think that's unnecessary. So these types of equipment videos, I believe, are incredibly helpful, and there are many of them already on the website. Next, I want to talk about kind of the range of different technical skills that we have available for people to learn from. And it just starts from the simplest of the simple, which is how to scrub into cases. So this is a skill that everyone needs to know how to do when they get involved in interventional radiology. And I literally just go through the steps of how to scrub in, how to grab your gown and your gloves, very simple, and then different variations. How are you going to do it if it's just gloves, which we do sometimes? How are you going to open things up when you're opening them up onto a sterile field, like you're opening up gowns and gloves onto the table, versus sometimes the table isn't the best place to open up things, and you need to find a corner of the room to lay out your gown and gloves, but you want to do it in a sterile fashion. How do you do that? All the way to actually, how do you put on your gown? How do you put on your gloves? How does that look from your perspective? How does that work? Very simple, but again, everyone can learn how to do this before they step in the room. They'll still have to practice it, but why not know how it works and not have to learn it immediately right before you do it for the first time? Another topic that I think is really, really important is establishing vascular access, specifically into the IJ, the internal jugular vein. I think that while many trainees may already feel proficient at this, I do think it's probably useful for actually maybe all trainees to take a look at this video series here, because there is variation in technique, and there's also maybe a lot of nuance that people may just pick up but not actively think about when it comes to doing these IJ punctures. And I literally, it's a little extensive, but it's broken down by topic, so you can pick which video you want to look at. But I start with how you scan, what you look for, how you hold everything, because I think things are actually different if you're doing like a tunneled line, where you're going to puncture in a different orientation from if you're doing like a temporary line, or you're going to do temporary access for just the case. So that will literally change, in my opinion, kind of how you orient yourself, how you hold everything, how you scan, how you position the patient, the table, and I go through all of that here. And then, what I've done here as well is I've created a phantom with a piece of pasta, which I think is a pretty good model for an internal jugular vein. And I literally, I go through how to do it, and I talk about all the technique. And again, I can have the luxury of really over-explaining without having to worry about a patient being uncomfortable, because we're just using a model, and I can just kind of show all the techniques and the skills all in one place, and I think it works really, really well. So this is, I think this is a really, really useful skill to just learn from these videos. So I would recommend that people check out the internal jugular vein portion of the primer. Getting a little bit more nuanced, this is an example of how to close high pressure AV graft versus, or fistula sites. It's not a very complicated technique. However, this is basically where we use a purse string and then a cut piece of catheter to create kind of this toggle situation where we can twist the piece of the catheter around the purse string and use it to kind of secure the access site. Long story short, this is a technique that I noticed not everyone was aware of, so I learned it at the Beth Israel, and then didn't see it used until I came to the San Francisco General Hospital, where one of my attendings there, Dr. Sujal Nanavati, showed me this technique, and he showed me some really slick things about it that I thought were really cool. So I created this video where you can be very, very experienced and even very senior, but you may benefit from seeing this particular technique, which is just another way to close these arteriovenous graft or fistula sites. So point is, regardless of your level of training, there probably is some material on here that could be useful to you to learn about. And I think that this video really goes in depth about this technique, and it kind of explains why it's helpful. Taking things to the next step, there are other parts of the primer that combine multiple skills together to get a little bit more sophisticated. So this is actually a whole series on how to remove chest tubes. Reason I actually made this is because at one of our sites we work at the trauma hospital and actually end up doing a lot of chest tubes and manage a lot of chest tubes and remove them on the floor. Ultimately, if you're not from an institution where interventional radiology really does much in the way of chest tubes, this can seem kind of foreign. So I noticed that a lot of residents, and myself included, who came onto the service just weren't really sure how to remove a chest tube. So I did something similar where I explain all the things that you need to take into the room with you. And I just kind of lay it out very clearly. So this is everything that you need to grab. And then I just made this little video going over all of the steps. And I think it's only like 5 minutes long. I have a little model here and everything that kind of explains all the key steps and how you're going to do everything. And I think that it's just really helpful because before you have to go to the floor and do it, you'll actually know all the steps and what it's supposed to look like. So that's just another example here. And then finally, the last thing I'll show you is, we've talked about all these different skills and fundamental things, reviewing imaging, all that good stuff. I think the next step and what I'm working on now more is to apply all of that to a specific procedure or disease process, making it very practical and applied. So here is for paracentesis, and then basically what you can do here is go through and all of those things come together, indications, contraindications, how to do the chart review, but they are applied. How do you scan the patient for ascites? How do you set up before you do it? How do you prep and put actually do the procedure? How do you dictate for a paracentesis? So all of that is organized here. I know that was a lot, but I just really wanted to show you all kind of what are all the things that you can just use tonight, tomorrow, that are immediately available to you now. That's just kind of skimming the surface. I think there's a lot more I'd love to show you, but for the sake of time, these are kind of the highlights. With that in mind, I think it's important to also discuss that while a lot of work has been done, there are plans to just kind of continue this work and move forward. As far as the Society of Interventional Radiology is concerned, there are more rotation guides that are going to be made. There is more aspects of curriculum, such as an ICU curriculum that is currently being developed. I recently had a chance to meet with Dr. Vatican Cherry, who's a real leader for SIR and the RFS as a faculty mentor, and he has a lot of wonderful ideas about kind of creating more clinical resources to put people in a position to be the best clinicians that they can be. And so the SIR, RFS, and Med Student Council, MSc, there's a lot of things that they're working on. I myself personally, now I'm on the eve of taking Diagnostic independent call here at UCSF, which is pretty involved and exciting. So I'm really focusing on some more of the videos for diagnostic imaging, the search patterns, going over interesting cases that are call and IR relevant. Similarly, I think I really want to work on developing more of these fundamental peri-procedural task pages and guides, and then also later on applying them to more advanced procedures. Paracentesis is just the initial pilot example, but literally can do the same thing with any radiology procedure that exists. Outside of even these organizations, I just want to put on your radar, there are other groups that are working towards making more online free resources. One example is IRpedia, which I recently met Dr. Zach Nuffer, who's a fellow at MD Anderson, who's about to become an attending soon. And he and I got connected and are working on making the IRpedia, which is the first and only Wikipedia-based site that's going to be the next Radiopedia for interventional radiology. So there are a lot of wonderful things happening, and as we talk about how you can get involved, just keep in mind that there are all these great groups that are trying really hard to kind of create more educational materials for other people. On that note, I do quickly want to say that I think that given that there are so many groups, it can seem a little confusing and unclear. And I think people can sometimes be rigid where they're like, well, I just want one resource, or I just want to be the one resource. I think the reality is that the amount of content that we're trying to curate and organize is more than probably any one group can truly cover by themselves, and it's always evolving. So I think it's really important to be fluid and flexible with our thoughts on this and realize that things are going to change. We're going to work together. What would probably be best is if all of these groups found ways to create kind of these building blocks or these kind of units of education that work together. The benefit of this is that we can have a lot of different organizations working together and being collaborative, but also as things change, as maybe something becomes irrelevant, we can replace that building block without the whole structure coming down. So I think that as we talk about all these things, it's really important to be aware that we should be very flexible and open-minded. I myself, when I started, was like, I want my website to be the one place everyone comes. I think it's much more practical to realize that I want to link to other websites, and if I do something well, have other websites linked to me, like we've done with the RFS website, and kind of approach it from that angle. Now, I've done a lot of talking about my thoughts, and I think we probably are at the point where it's like, okay, Masis, we get it. You're very passionate. You lost all your hair on this pursuit, on this journey. Great, but what do you want us to do? So I think it begs the question, as I'm giving this webinar, what am I hoping will happen as a result? So I don't want it to sound like a get-rich-quick scheme, but there's pretty much like 4 steps. It's a 4-step program, very simple, very, very basic, but I think effective, and I'll pitch it to you right now. So step 1, I think, is really easy. Whether you're a trainee, a mentor, resident, fellow, medical student, attending, whatever, the easiest thing you can do now is to use these resources if you think they'll be helpful for you. They're free, they're available. You can go to it right now. StepWords is right there. But then also, realize that you can share them with others. And, that also really doesn't take very much work. And as a mentor can save you some effort as well, too. If I've done something or the RFS has explained something that, you find yourself having to explain over and over again, just, point them in the direction of our videos. Send them a link to the website. And you won't have to... you can save that time to teach them something else, something more complicated, something that builds off these basics. So I think that's easy. Step 1. I hope everyone can do this step, either for yourself or for other people. Just use and share the resources respectively. Step 2, I think, is important, and it's about making teaching a priority. This has a couple meanings. I think number 1, people should think of themselves as educators. Even if you're a trainee, realize that no matter how far you get in your career, you probably always will be a version of a trainee and a version of a mentor. Even a first-year medical student has people that they can mentor. Even when you get to your first rotation on IR, there will be someone who's going to come the next month after you or the month after that. You can be a mentor in some senses to that person, even if you're at the same level of training. No matter how senior you are, there may be more that you have to learn as well. There's, like I showed you, all these different techniques, nuanced. Realize that we're all on the spectrum of being trainees and mentors, and it's kind of, it's almost like the nesting dolls, So no matter where you get to the point, there's someone you can train, someone that can train you. So it's very, very important. So I think I myself had to come to this realization early on, where I was kind of expecting, everyone to just teach me things, And I realized that that's great, and yes, I should have teachers, but also my colleagues can be teachers. I can learn from people my same level. And then I myself, I need to, you know, just like I was frustrated in some instances where people weren't teaching me things, I need to take it upon myself to be that teacher for other people. Otherwise, they were going to be just as frustrated as I was at the same stage. Other side of this coin is that, I've had a lot of discussions with people over the years where we all kind of acknowledge that education is very important. When we think about why we do research, while we work on developing new procedures and cutting edge things, we realize that the point is all about patient care. And again, it's not just about caring for one group of patients, it's about caring for all patients, making care available to as many people as possible. I don't think anyone would argue with me if I said that perhaps one of the best ways that we can most robustly and quickly improve the delivery of care is to invest in our trainees, to teach them how to do a good job. As I mentioned, I'm about to be on call, and we have independent call here. My program has invested so much in me, and I've noticed it, where they realize overnight I'll be the one putting in reads, and the teams will be acting upon what I pick up and what I don't, and what my report says. So I don't think anyone can argue that teaching trainees to do a good job very quickly manifests in either, in good care. So I think we're in a position where we know this to be true, but because of some infrastructural reasons, a lot of people just accept that, teaching isn't really rewarded in the same way that research is for academic advancement and so on and so forth. I think that some of that may come with time and is infrastructural. We can't change immediately. However, I will say that I think for our specialty in our field, some of it is us. We can decide if it's something that we value and that we reward. So I think it's worth thinking about. If you acknowledge that teaching is important, that it manifests in good patient care, which is one of the ultimate goals that we strive to as clinicians, I think it's worth thinking about what you're doing to reward that type of behavior when you interview someone for a position, either for, medical school, resident, fellow, new attending. Are you valuing those educational efforts that person has made? Or are you noticing that they've made those as much as other, things that we typically think of as CV builders? Just something to think about. Okay, that's enough of that soapbox. Step 2 is a small step, but there's a lot that I apparently have to say about it. Next step, it actually goes hand in hand. It's about documenting and sharing your learning. I won't belabor this point, but I think that as we kind of accept our role as being educators, it's important to think about putting what you learn into a usable format. So if you're learning something and you probably won't revisit it for a while, it can be really, really valuable to put it in a format where later down the road, when you come back to it, it's not a mystery anymore. You've written it out. It's very clear. You can relearn it quickly. I wish for myself that I did more of this throughout my life, where I like when I figured something out that took a while to figure out, that I actually put it in a way where I could come back to it and it would be there for me. And my website actually became a version of this. I said, you know what, I need to kind of use this as a way to document my learning and put it in a format where I can use it. I can pull up on my phone and then I can share it with other people. Your efforts don't necessarily have to be so elaborate, but do think about, and I know there's already a culture of this in medicine about making like study guides and sharing them, but really be very deliberate if you have the time, to put it in a format that's easy for you to learn from again, and it's easy for other people to learn from too. And it can make it so easy to kind of pass things along and be helpful to other people. Last step, here's all my contact information. I have a couple different email accounts. I'm on social media, so you can gram me or tweet at me. I'm not very, savvy with those, but you could you can also email me, and I will respond. Just reach out. Let me know if anything I said, if it's interesting to you, if you want to get involved. Right now I'm kind of focusing on call prep for diagnostic reasons, but regardless, I'll try to connect you with whoever I can. I'll try to keep in touch so we can work on something. If you are interested in some of the resources that I have, like for general surgery, internship, or other elements that aren't quite things that we highlighted here, all good. Just let me know. I will do my best to help however I can. So, and then also can reach out to the RFS, SIR. If you're interested in IRpedia, if that sounded something like you're interested in doing, I can connect you with that group as well too. So just let me know. Reach out if you're interested, or if you need anything. And I just will finish with saying, like we've talked about, I think there's a lot of good things that have happened, a lot of good changes that we're making, but now we're kind of in a position where as things change, we need to change with them. I think we've been doing education a certain way for a while, and I think a lot of people have been thinking about how we can improve it, and it's kind of that part of the infomercial like we have here, where some of the juice has spilled, and there's got to be a better way, and I think that we're going to figure it out together. And if you want to get involved, just let me know, and hopefully I'm part of the solution here, and that's kind of what I'm working towards. But just realize that, especially amidst these COVID times, shelter in place times, students can't rotate, and even residents can't rotate and do their orientation the same way that they've been used to in the past. We must adapt, and we must meet these changing needs, so our trainees get the best support and training so that they can do the best job moving forward. There's a lot of people I want to thank, and again, along the spirit of rewarding and acknowledging trainees that have been vital to helping make educational materials more available for other people. I just want to thank Dr. Lindsay Masalik, newly minted doctor, just graduated and just matched at MD Anderson for Interventional Radiology and DR, so her integrated IR program. Excellent, Lindsay. Thank you so much for all of your help. Lindsay was so essential to getting me kind of connected with everyone with the RFS and SIR. I kind of explained to her some of my ideas very early on, and she immediately understood and acknowledged the value and wanted to help. Earlier, when I talked about investing in trainees, I was talking about people like her. So she resembles, in my mind, the type of people that I want representing this field in the future. And I think that the field is very lucky to have someone like her. Anyway, so I just wanted to say thank you so much. So helpful. And then also for the away rotation guides, for the site-specific guides, those general resources on the RFS website, she was essential. She was the former chair of the Med Student Council for SIR, and she has passed the reins on to Rayan Aboud, who is the current chair now. And again, Rayan just became a fourth year at Wake Forest University. He has been also so helpful with getting things off the ground. He really helped me organize this webinar. I can't thank him enough. Poor guy, with how excited I get about these things, I pestered him so much. But he was such a good sport. So Rand, thank you so much. And, other than that, there's a lot of people at the Society of Interventional Radiology throughout the resident fellow section. I just want to say thank you to Dr. Kumar, who's one of our faculty members here at UCSF, who's always been such a wonderful mentor to me, Dr. Vatican Cherry, who I mentioned a little bit before, all the residents and students that worked to put on the webinar and to get the website up and running. Thank you so much. And even at my institution, I am so fortunate. There are so many people I want to thank. Again, starting with my program director, Dr. Sunmi Cha. Thank you so much for everything, for always being so supportive, for being so supportive of this work and the webinar and getting the word out. Dr. Maureen Cohey, thank you for all of your guidance and your passion about interventional radiology. She leads our interventional radiology section here at UCSF. Dr. Evan Lerman, who's the fellowship director here. Again, Dr. Kumar, who's very involved and has been a wonderful mentor to me. Dr. Miles Conrad, who works at the San Francisco General Hospital and at the UCSF campus. Also just a phenomenal mentor and role model. Dr. Sujal Nanavati, Dr. Mark Wilson, who heads up our radiology and interventional radiology sections at the San Francisco General Hospital. Dr. Curlin, Dr. LaBerge, these are really people who have worked so hard to bring the field of interventional radiology to where it is now, and who have been very essential for developing the new residency. And also I want to mention Dr. Matthew Amons, who's one of the interventional radiologists here at UCSF. He is also a wonderful mentor to me, and I'm very grateful to know him. And he is also just embodies being an educator so well, and is another great role model. There are former and current fellows that have been helpful and kind of being point people for me. There are other residents that I am so fortunate to know. Dr. Joel Harwin, who is the president of the Radiological Society of California, who helped promote the event and raise awareness, and then also is one of the more senior residents who has been a mentor to me in many senses. Dr. Rana Rabe, who is the integrated resident of my year for interventional radiology, who's just fantastic person and is always someone I bounce ideas off of, and really just has wonderful clinical judgment and perspective, and many more. I won't kind of talk about everyone here. I did mention a few people, but back from medical school and across all the clinical rotations, these are the people that have been so essential to my growth and development as a clinician, and have fostered my interest in education and interventional radiology. The point of this talk is to realize that there are so many people like this that have such an impact on trainees, and I think that it's really, really important to acknowledge everyone as best as you can, because it really is the effort of everyone that kind of comes together to help people like myself to move forward. And honestly, it even goes back to when I was in college. I went to the University of Portland, and the faculty there, they weren't clinicians, but some of them are even on the call right now. Dr. Tara Prestholt and Dr. Jeffrey Brown. These are the people that showed me how important a good educator was, especially early on into your career. And they are people that I'm still in touch with right now, and I'm just so grateful to have been their student, because I'll never forget everything that they've done for me. So thank you, everyone. Here are my references. They're really just for my funny pictures and funny gifs, so it is important to give credit where credit is due. Yeah, and then finally, I want to thank all of you for spending the time with me for this webinar. I know it's a challenging time with all the things that are going on, so I appreciate your time. I hope that this was useful, and then I know people have been submitting questions during using the question feature, so we'll go over some of those questions here now. So thank you very much, everyone. Thanks for joining. I really appreciate your time. It means a lot to me to be able to talk about this topic.